What we're going to talk about today, our last show here of the blood vessel chapter, is really going to be taking a look at why do capillaries have the flow that they do. One of the ways we're going to measure this is just basically how many milliliters per minute are going to be going into these. And the main thing it comes down to with any set of capillaries is that you're going to have a high enough blood flow into there to actually fill those capillaries or perfuse them. Again, getting a lot into under what conditions, why would blood be going in there or not, and what's regulating that. So how much blood is going into a particular area is going to depend on a few different things. One of these obviously is going to be how many capillaries are there. So that is really that degree of tissue vascularity. How many vessels are there? The other thing we're going to see is it's really going to come down to is there any local factors that are being released that are going to influence the blood flow into here. So things like histamines, other stuff like that. And then just overall blood flow supply is going to play a role in this as well. So one of the things that is obviously going to be a big deal in terms of local blood flow to a particular tissue is going to be how much vascularization. Things that have a lot of blood supply obviously are going to be perfused much better. So things like skeletal muscle, like the heart, like our brain, these have a large number of blood vessels, and because of that, generally are going to get a large flow of blood into those areas. And from back in Anatomy and Physiology 1, when we talked about the different tissue types, we know that things like tendons and ligaments, those dense regular connective tissues, they are for the most part avascular. Similar thing with cartilage. You're not going to see a lot of blood flow going into those particular tissues. One of the things that influences how much blood is going to be going into a tissue is the process of angiogenesis. Angiogenesis is just really the fancy way of saying the body laying down new blood vessels. Not surprisingly, and we're not going to get into it, but not surprisingly, this is a highly regulated process. Again, for tissues to be built, generally we're going to have the blood vessels to supply it. The lack of this sometimes is going to lead to areas where something doesn't grow. So a good example of angiogenesis not working to supply a tissue well would be sometimes when cancers occur, you'll get a tumor that has a necrotic interior because angiogenesis hasn't caught up with the speed of that tumor's growth and will lead to an area that isn't getting good blood supply to it, and therefore it doesn't survive that. Things that can influence this, again, if you stress the body in a particular way, generally it's going to try to respond and deal with that stressor. So, for example, with skeletal muscle, if you're doing something that you're continuously aerobically training and always having that muscle requesting more blood, one of the things that's going to happen is it's going to release factors that are going to bring about the formation of blood vessels. Anytime you're adding tissue to your body, so things like gaining weight, you are generally going to also need to supply that tissue. And then finally, certain areas, especially those areas that are very high value to us, if you start getting blockages in certain areas, sometimes this will trigger the formation of other blood vessels to kind of work around or detour around an area that's not getting the blood supply to a particular organ that it needs. Again, just like anything else, it's use it or lose it generally in the body. So either you continue to need to maintain this, or if you stop doing that particular activity or that weight is lost, for example, we're going to lose the blood vessels that were supplying that tissue. So with, for example, somebody who was doing a ton of aerobic training and then goes and has an injury, doesn't do it for 6 months, you're going to see losses in the blood supply to that tissue. Same thing when you lose weight. If you had a lot of adipose tissue and you're having to supply blood to that and then you lose 50 pounds, you're going to reduce the amount of blood vessels needed to supply that tissue. And that whole process is called regression. Another thing that's going to influence blood flow to a particular tissue is going to be locally regulating factors. So things that are going to be released a lot of times by the tissue, and in a good number of times to tissue damage or changes in metabolic activity in that tissue. These are going to be some of these locally regulators. They would refer to these as vasoactive chemicals. So vasoactive meaning vessels, activating that, chemicals that do it, vasoactive chemicals. And these are going to be the things that stimulate changes in those blood flow to there. Again, things can do this one of a couple different directions. So we can have certain factors that act as vasodilators that would open up those arterioles or relax precapillary sphincters, let more blood supply that tissue. You could also have vasoconstrictors being released by a tissue that would constrict arterioles and contract those precapillary sphincters and lead to reduced perfusion of that tissue. One of the ways that some of these local factors are regulated is going to be through changes in metabolic activity. So if you're doing, let's say, a lot of aerobic activity, you're using up a lot of oxygen, a lot of nutrients, you're increasing your levels of acidity in that area, the buildup of lactic acid, the amount of carbon dioxide being activated in these areas. One of the things that these substances do as being a byproduct of this metabolic activity is all of those are capable of acting as local vasodilators. So as you're taxing this tissue more, in and of itself, the byproducts or waste products that it makes act as a way to increase blood flow to that area to help get rid of them. And again, as you get more blood to that area, you're going to take more of the stuff away, and then the vessels can start constricting again in response to the removal of that carbon dioxide, of that acidity. That is one example. Another example here is reactive hyperemia. The other one would be kind of more of active hyperemia, that the example I just gave of metabolic activity. Reactive hyperemia is this idea that sometimes when blood supply is lost for a particular reason, that you're going to get this temporary large increase in blood flow to the area. So probably one of the best examples of this is when you've been out in the cold and your body starts trying to close off capillaries to conserve heat. Once you go back inside, a lot of times you'll get that flushing of your cheeks, your hands will get really bright red. This is all in response to the fact that because there wasn't good supply to that tissue, when now there is an opportunity and we can open up those things again because we can conserve our heat, you're going to have blood rushing back into that area to warm up that tissue, to remove those waste products, and then after a little bit of time, the flow, it's going to get a little bit more of that vasoconstriction again and go back to a normal flow pattern. And this is, again, just kind of showing what I just talked about here with active hyperemia, increased tissue metabolism. You get things that are these waste products that act as vasodilators, get more blood going into there, increase blood flow into that. And as long as the stuff is returned, the waste products are removed and the nutrient and the oxygen supply is returned to a higher level, that blood flow will start decreasing. With reactive hyperemia, again, it was constriction or occlusion, some type of blockage led to this. Again, different vasodilators are going to accumulate in there because this tissue isn't getting enough oxygen. Sooner or later, if you stop that occlusion, stuff's going to go in there really fast, get a really large blood supply to that tissue. Like I said, a lot of times if it's been really cold, you'll get reddening of the cheeks, reddening of the hands or other tissues that were not letting blood go to it because of that physiologic kind of vasoconstriction to reduce loss of body heat, for example. Other reasons that we might have changes in local regulation have to do a lot of times with tissue damage. So one of the things that can happen when you damage tissues is a lot of times those damaged tissues will release, or white blood cells that get to that damaged tissue will release different factors. A lot of times we call these inflammatory cytokines. A good example is histamine or bradykinin. Both of these are in response to tissue damage. And what they do is they will cause local vasodilation in those areas and again allow a lot more blood supply to get there to help fight off whatever the infection might be in that particular area. There's some other examples of this as well that can cause vasoconstriction, things like prostaglandins or thromboxanes. And again, these are more when you have a bad enough damage to the tissue that you are losing blood. A lot of times these are going to cause that vasoconstriction, which we talked about with hemostasis, to help prevent that blood loss. So again, in response to tissue damage, we can have both things that are going to lead to vasoconstriction and vasodilation. Other things that are going to deal with this is, again, just that overall supply to the heart and overall blood volume. As you exercise, again, we've talked about this with the skeletal muscle pumps, the respiratory pump. Increased activity is going to return more blood to the heart. We can increase that cardiac output, increase that blood pressure. And again, the more pressure we have, the more flow that we have to divvy up. If you have a higher pressure, you can open up more vessels to supply that as long as there's enough blood. That's one of the things we see when we are being active. Sometimes you can get to that 3 to 5 or 7-fold increases in cardiac output that allow you to send a lot more blood to the muscles and still maintain flow to a lot of other areas. And again, if we do this, if we don't have this happening, you get a lot of venous pooling. If you're sitting down, you stand up really quick, sometimes you can get that kind of dizziness, that loss of blood flow to the brain. One of the things as well, if you pull too many G's, so for example, jet pilots in those really high level fighter planes, they actually wear pressure suits, so when they are pulling out of a dive and all that gravity is pulling a lot of G's down, blood down to the legs, you will actually squeeze on that to help maintain that pressure so the heart still has enough blood to pump. If that wasn't happening, what can happen is if you pull too many G's, you will actually pass out. And if you've ever watched any of the space movies where they have the little thing that they basically put the person in the thing and it spins around and they pass out, what's happening there is all the blood is pooling in their legs when they're doing that. And again, if you don't have enough blood supply to supply those metabolic needs, you're going to have the issue where you could have shock, where you just can't get enough blood pumping out of the heart to do that. Or again, if you're not getting enough return, you can have that return shock. So you're getting either not enough there, inadequate pumping of the heart could lead to shock by not getting enough cardiac output. So heart's not pumping correctly. There's some type of arrhythmia in it. That would be one example that could lead to shock. That's cardiogenic shock, where low venous return is just heart's working fine, but you're not getting enough blood back to the heart. We're going to see that there is definitely some specialized circulatory routes to keep certain things perfusing well, even when there is decreased blood flow. One of the things that we always have to keep blood flow to is the brain. Just a couple seconds of deprivation is going to be enough to have you lose consciousness. If you've ever watched MMA and they do the kind of the choke outs, that is what they're doing. They're basically blocking the carotid arteries for a very short period of time to cause the person to lose consciousness. If you lose blood flow to the brain for about 4 to 5 minutes, if you're at normal body temp, that is enough that it's going to cause irreversible brain damage. And one of the ways that we also look at activity in the brain a lot of times is flow in there. So that's one of the things they do sometimes with those PET scans, is they will put tracers in there and they can see where more blood is going to in the brain, and it's actually a measure of brain activity in there. Especially the chemistry in these different arteries. Again, as blood pressure decreases and increases, we're going to see changes in the arteries in terms of dilation and constriction. Again, dilating as blood pressure drops to make sure there's still enough blood coming there. Constricting as blood pressure rises to try to not let too much blood get through them. Other things they definitely respond to is blood flow, is carbon dioxide levels, pH levels. Both those things will trigger vasodilation if we see those in the brain, because that's saying that the brain is not getting enough oxygen. We're getting a buildup of CO2 because we're using up almost all the oxygen. Hypocapnia is not enough carbon dioxide. You'll get vasoconstriction with that, and that sometimes if you're hyperventilating, you will get vasoconstriction, and that's why sometimes you can pass out due to hyperventilating. You get your pH so high that your blood vasoconstricts enough that it causes you to pass out, actually. Muscles, definitely a lot of variability in these ones. It's really depending on, are they active or at rest. At rest, a lot of constriction going on here, not a lot of blood flow to these ones in terms of overall amounts. What we're going to see is with exercise, we're going to get a lot of dilation of these precapillary sphincters. We will perfuse the tissue a lot more, and in terms of flow rates, we can see, like it says there, up to 20-fold increases in flow rates to that muscle depending on how active it's being. And again, as the muscle's contracting, much like we talked about with the heart, it is going to constrict some of that flow in there, but as it goes into relaxation, that blood can get in there and get to the areas that it needs to. And really the last thing to talk about is a little bit about the pulmonary circulation and just some of the differences that are going on here. So when we talk about pulmonary circulation, it's really supplying those pulmonary capillaries, which are at just the gas exchange structures. If we talk about like blood supply to the trachea, that is part of the systemic circuit, not the pulmonary circuit. Carbon dioxide, we know, is being generated by the tissues, is being brought to those alveoli, and again, we're going to see later on, goes with this concentration gradient into the alveoli, where you have oxygen going from the air sacs to the alveoli in the lungs into the blood with this concentration gradient. And that's really the purpose of this pulmonary circulation, is to allow the exchange of those two gases. Again, That's really the only purpose that's going on there. So you can kind of see what's going on there and how it's branching out. Again, it's a lot of blood going to these lungs. Kind of the amount of blood going on the left and right sides is about equal. So, and it kind of gives you the pathway here. Again, not one I'm going to ask you to know all the different parts of, but no, heart leaving, it's going to come to the right side of the heart, leaves out that pulmonary trunk, goes to the arteries and arterioles over to the gas exchange structure. It's going to come back to the left side of the heart through those pulmonary veins. When we compare it to the rest of the systemic circuit, we're going to see generally wider lumens in these ones, less elastic tissue. It's not as high a pressure system. It's actually a much lower pressure system. Doesn't have particularly long vessels because, again, if we think about where the lungs are versus the heart, it's not a particularly long trip. I mean, overall, if we look at this, it's about a 25/10 type of systolic over diastolic in the pulmonary capillary. It's not one that we can really measure particularly easily. And again, it's going to be a gradient there, that highest when it's leaving the heart and back to almost zero when it's coming back into those pulmonary veins, much like we saw with the systemic circuit.